With Omicron cases on the rise, Central Georgia nurses are back on the front lines again. Remy Cohen talked to two nurses who give different perspectives on coping with COVID through a nurse's eyes.
If you don't like challenges, then you shouldn't be a nurse.
Places where it was like, this is COVID, I went the other way.
Sande has worked as a nurse for close to 40 years, and Mason McDaniel started his career in nursing about 4 years ago. But both agree COVID became physically and mentally draining.
Emotionally, sometimes it's hard. We kind of give all we've got to give here. It was rough to see people and, knowing those people were probably, when you didn't see them a week later, it's because they had passed.
Day works in Piedmont-Macon's ICU unit and sees the patients at their worst.
Taking care of COVID patients is very hard in ICU. It's very taxing. Most of them, once you get to ICU, most of them haven't lived.
And when family members couldn't visit their loved ones,
You'd have people on FaceTime like, here's grandma, say whatever it is you want to say to them because they aren't going to be here probably the next day.
with all of this darkness and what may appear not much light at the end of the tunnel.
I've had patients where I'm like spending the whole day getting the family ready to know that this patient is not, there's no way they're going to make it. And then I leave and I come back in a day or two and they've gotten better.
Then a miracle happens, making it all worthwhile.
A really, really good day can outweigh a lot of bad days here. You see people who come in here half dead and a couple weeks later they're walking out of here. I mean, it's remarkable sometimes, and it makes it worth it.
In Macon, Remy Cohen, 13 WMEZ News.
According to the Bureau of Labor Statistics, the need for registered nurses is expected to grow by 9% from 2020 to 2030.